taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike Lenore and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch.
Welcome to today's edition of the Wellness Watch and Black Doctors Speak, the podcast. Our subject today is sleep apnea, a common sleep disorder affecting an estimated 25 to 30 million adults in the U.S. A significant portion of these adults are undiagnosed, with studies suggesting that to be around 85%. Our special guest today is Aiko Loo. She's a nurse practitioner with a specialty in sleep and obstructive sleep apnea. Ms. Loo, how did you get interested in something like sleep, and particularly sleep apnea?
Well, I got interested in sleep medicine to start, just because we don't really know much about sleep. We don't really study it, but we spend a third of our life sleeping. Everyone sleeps, so I was really curious about it. And sleep apnea is one of the most common sleep disorders, so that's how I got into sleep apnea. I think it just came with the field. Most of my patients have sleep apnea. It affects a lot of people. It's severely underdiagnosed. I think there's way more awareness to it now, but it really can impact your day-to-day functioning. So yeah, it's just most of my population, the people that I see, they have sleep apnea. That's what they come to me for.
Ms. Loo, one of the things that is always an enigma to me is that people who snore all don't have sleep apnea, but those that have sleep apnea have no understanding of the impact that something like that has on their body.
That's right. Yeah, snoring is one of the main symptoms that people come to the sleep disorder clinic with, but it can also be fatigue during the day. It could be high blood pressure or uncontrolled diabetes, uncontrolled blood sugars. Sometimes people stop breathing, they wake themselves up, or they're coughing themselves awake, waking up with a headache, all sorts of things. Some people have red high blood cell count, right? So I would say the most common one is snoring, or people see them stop breathing if they have a bed partner.
It's very interesting, the snoring part. How do you tell the difference between someone who is simply snoring and someone who's snoring as an early symptom of sleep apnea?
The only way to really tell is if you do a sleep study. So I always order a sleep study if anyone snores, even if it's intermittent, even if it's soft snoring. But the only way to tell the difference between the two is to do a sleep study. The in-lab sleep study, where you spend a night at the clinic, you would come in the evening, either 9 or 10 p.m., somewhere around there. A technician will hook you up with electrodes on your head, your chest, your legs, and you sleep in a bed. It's kind of like a hotel room, and there's an intercom and a camera, so they're watching you. The technician is watching you from a separate room, and you just try to go to sleep. So that's when we start with the brainwave, the electrodes, we can monitor brainwave activity, so we can see if you went into sleep, what stage of sleep you're in. We're monitoring oxygen level, your breath, your respiratory rate, all of that. And then we wake you up around 5:30 in the morning, get you all unhooked, and then you're good to go.
Explain the relationship between sleep apnea and oxygen. What are the consequences of the oxygen bubble?
When there's not enough oxygen getting into any of our cells, it can cause cell death, right? So if that's happening in the cells of the heart or in the brain, we're talking heart attack or stroke. Those would be worst case scenarios. But it's causing a lot of organ damage if we're not getting enough oxygen. Stopping breathing. And does it affect the oxygen level? and does it awaken the brain? So those are the things that we can see when we do a sleep study. And the naked eye can't really see that. Like we can hear the snoring, we can maybe see someone stop breathing, but we need those parameters to really diagnose it as a sleep disorder. The oxygen level dropping means that there's an obstruction in the airway, and we all need breath. We all need to breathe to survive, right? It's one of our basic needs to live. So if we're not getting enough oxygen, 90% or above, like 90% is the minimum, right, that we need. So if it goes anywhere below that, then there's something else going on.
Well, with so many clinical parameters to look at, how do you make the difference between someone who's snoring with a little bit of apnea and someone who has a significant problem?
Number of times you stop breathing per hour. So anywhere between 5 and 15 times an hour would be considered mild. 15 to 29 or 30 is moderate sleep apnea, and anything above 30 times an hour is considered severe sleep apnea. You're in the lab and it's a really severe case. The technician may wake you up to put what's called a CPAP machine on you. Especially if it's severe and your oxygen is dropping really low. But otherwise, if it's in the mild or moderate range, you'll go home and then you'll review the results with your sleep provider, and then they can talk to you about what the treatment options are.
When you've got somebody in the room, lying in bed, lights on them, cameras on them, it must be somewhat difficult.
Yeah, and that's one of the biggest concerns for people is like, how am I gonna get to sleep with all that, those wires all over my body? We're not asking you to get the best night of your sleep, or it's more of a data collection that we're doing. So you can bring your tablet and your phone, but they're gonna ask you to turn it off at a certain point. And you just kind of do the best you can. The minimum amount of sleep that we need for it to be a valid sleep study is 2 hours of total sleep time. So you have from about 10 p.m. until 5 a.m. to get 2 hours of sleep. I mean, that's the bare minimum. Most people get maybe 5 or 6 hours. It's not going to be a normal night's sleep, but it's more about collecting data.
So now we've got someone whose oxygen concentration has dropped, who's having difficulty snoring, uncomfortably sleeping, and you've made the diagnosis of sleep apnea. What happens at that point?
Yeah, well, we got to treat it, right? So we can treat it with the best way is a CPAP machine, which stands for continuous positive airway pressure. So it's basically pressurized air that goes into the upper airway with a mask that you wear on your face. So that's the most effective way to treat sleep apnea. But I would first have a discussion with the patient about, the degree of the apnea that they have. And if it's not a severe case, then there are other alternatives too.
So I've talked with many people who've used the gadgets that you mentioned and the techniques that you talk about, and they find it somewhat difficult to keep that mask on all night. They feel it's uncomfortable. They wake up threatened by it. How do you get past that?
The main complaint is the fit of the mask, right? So you really need to work with the patient, the provider and the patient need to work together to find a good mask fit. That's really the key. But also allowing yourself time to get adjusted to it. Most people try and it doesn't work for a few nights, so they give up because it's so uncomfortable. But I always encourage people to keep trying, even if it's on for 30 minutes, keep trying. Or if it's really difficult, try using it during the daytime when you're awake and you're more in control of your environment to kind of acclimate to this completely different way of sleeping. So especially for someone who has really excessive sleepiness because of the apnea, and they start using the machine, they get adjusted to the machine, they feel like a different person. They feel like they got their personalities back. They can go back to doing social activities. They're not falling asleep behind the wheel. All of these things that some of us might take for granted, right? When you get your life back, that's very rewarding. If someone is using a CPAP machine, that's a 98% success rate of eliminating sleep apnea. So it's a really high success rate with a machine. First drop, I'm really happy about that. If my patients are breathing, I'm happy about it.
Yeah, it's interesting that you have these gadgets that work if they're used appropriately. But many people depend upon the sleep medicines. What's your opinion of that?
The most recent medication, because there's only really one medication if we're talking sleep apnea, was Zepbound. That was FDA approved for sleep apnea specifically, but you do have to have a diagnosis of obesity with a certain BMI, body mass index, and a diagnosis of moderate to severe sleep apnea for you to be approved for something like Zepbound, which is for sleep apnea purposes, it's the weight loss part that's going to help with the apnea.
Well, Ms. Lou, thank you so much for taking the time to join us. Clearly, this is a problem that many people have and don't recognize it. Snoring is not just sometimes an insignificant issue. It may represent a much deeper pathophysiologic problem. That means your oxygen dropping with damages to other organs and long-term consequences. We appreciate you taking the time, and we appreciate the audience for taking the time to join us. And remember, health is your biggest asset, so protect it. And remember, our program is sponsored by the African American Wellness Project. So not only look at our programs here, but look at the Well, thank you, Ms. Lou, for joining us today, taking from your busy schedule. It's clear to me that many people who snore have obstructive sleep apnea and don't know it, don't recognize the dangers that it poses with drops in oxygen and damage to tissues and subsequent consequences with the heart, the lung, and other organs in the body. I think that your contribution to this particular problem is significant, and we appreciate you for taking the time to join us. And also for those of you who listen, don't forget we also have a podcast called Black Doctors Speak and radio projects on KPLX in the San Francisco Bay Area. Remember that health is your biggest asset, so protect it.